A class. So I'm going to get right straight into it. For question one, in your career, it's likely that you will come across patients who are against prescription medication, but it's for taking four herbal supplements and over-the-counter OTC or OTC medication for medication and mental health issues. If it's for the client, what risk would you inform them regarding that herbal supplements and OTC medications? Cool. All right. So getting right into this, if I were to be working with a client who was against prescription medications but preferred herbal supplements or OTC products, the first thing I would do was to acknowledge and respect their perspective, build trust, work with the client, and I would want to understand why they feel more comfortable using natural or over-the-counter products instead of like prescribed medication that we know based on evidence and research that it will support them in whatever they might be dealing with, which is like whether it's anxiety, depression, or some other form of mental disorder. At the same time, I would educate them about some important risks that many people are unaware of. One common misconception is that if a product is labeled as natural, it must also be safe. And I think there's one specific brand. My wife just purchased a not medication, but like supplements. It's called like Nature Valley or Bay. I don't know, but the title, the company, the product, it starts with nature. So that would be a great example of this. But however, herbal supplements can still have powerful effects on the body and may interact with prescribed medications, other supplements, or even certain foods. Um, for example, St. John's wort, which is commonly used for depression, can reduce the effectiveness of medications such as birth control pills, blood thinners, and certain antidepressants. This is really important to know for someone maybe like myself who has heart problems. Thankfully, I do not need to use any blood thinners or anything like that. But in case I was, and I decided to take some form of like medication, such as like St. John's wort, it would be really important for me to know this. Um, it can also increase the risk of serotonin syndrome when combined with other medications that affect serotonin. Um, I would also explain that unlike prescription medications, many herbal supplements are not regulated by the FDA for safety and effectiveness before they are sold. This means that the strength, purity, and the ingredients may vary between brands, and some products have been found to contain contaminants or ingredients that are not listed on a label. The same is true for over-the-counter medications. Even though they don't require prescription, they can still cause side effects or interact with other medications. For example, long-term use of certain pain relievers can affect the stomach, kidneys, or liver, and some cold medications may increase blood pressure or worsen anxiety. Now, as a therapist, I believe it's important to encourage clients to tell all of their health providers about other medications, vitamins, herbal supplements, and over-the-counter products that they are taking. Having a complete medication history helps providers, such as doctors or therapists, identify potential drug interactions and make safer treatment decisions. Now, question two, are there herbal supplements or OTC medications that I take or have taken that have learned new information about, such as side effects, drug interactions, or the importance of listing them in medication history? Over-the-counter supplements that I have taken is melatonin, mainly to help me with sleep. I don't struggle as much with it as much, but I did for a while. Before learning more about psychopharmacology, I assumed that because I was sold over the counter and was considered natural, it was completely harmless. However, I learned that melatonin could still cause side effects, including daytime drowsiness, dizziness, headaches, and change in sleep patterns if it is not used appropriately. I also learned that it can increase, or not, sorry, interact with certain medications, including blood thinners, diabetes medication, blood pressure medications, and medication that affects the immune system. Again, thankfully, I don't use blood thinners, even though I do have cardiovascular health issues. But just in case I did, and me taking melatonin, I don't know what would have happened. Thankfully, nothing happened, and I was not taking dinners. But this is part of like the reason that it's important to be knowledgeable and aware of what clients are taking and how they affect and can affect other things being consumed. Another thing I found interesting is that melatonin supplements can vary in strength and quality because dietary supplements are not regulated the same way as prescription medications. This means that the amount listed as this label is not always exactly what is contained in the product. One big lesson I learned is that over-the-counter medications and supplements should always be included in person's medication history. Before this course, I probably would have not thought to mention something as common as melatonin, and I don't think I did if I was taking therapy or having therapy at the time, or even daily vitamins during a healthcare visit. Especially daily vitamins, I don't take those, but it was before this class, nothing that ever crossed my mind like, oh, I need to let my doctors know. It just didn't make sense until now. As I now understand that these drugs can influence treatment decisions and may interact with prescription medication or other supplements. Overall, this has changed the way I think about the herbal supplements and OTC medications. I recognize that natural does not always mean safe, and that these products should be used with the same level of awareness and communication as prescribed medication. As a future therapist, I think it is important to educate my clients about these risks while respecting their preferences and helping them make more informed decisions about their care. Thank you.